Doppler in Obstetrics. Since 1977, to study fetoplacental, which is the umbilical circulation, and since 1980s to study uteroplacental uterine circulation and fetal circulation, we are using obstetrical Doppler. Today, this method has become an important tool for qualifying high-risk pregnancies. How to perform obstetrical Doppler examination? The patient position, patient is supine on the couch, properly covered, in the presence of female attendant and or assistant, especially when a male sonographer or radiologist or gynecologist is scanning, transabdominal ultrasound. The gestational age determined by BPD, head circumference, abdominal circumference, and femur length, amount of liquor, subjective or objectively measured, placenta and umbilical cord examination is done. Then is the general survey of maternal pelvis and fetal morphology. The approaches for Doppler requirements are the endovaginal, which is transvaginal ultrasound, which is performed in early pregnancy usually up to 13 weeks, or in obese maternal habitus in obese patients. In early pregnancy, we prefer to use 7.5 megahertz TVS up to 8 weeks, 5 megahertz from 9 to 13 weeks. Transabdominal ultrasound after 14 weeks, we use transabdominal sonography, provides the same after 14 weeks. The transducers TV probe should have dynamic focusing, produce minimal artifacts, should have sensitivity, color to demonstrate small vessels with low velocity blood flow, which is the characteristic of the trophoblastic changes. So it characterizes it. Machine, the Doppler, duplex Doppler or triplex Doppler is necessary for displaying Doppler waveforms and for calculating RIP, PI, and SD ratios. Doppler signals are very important. This is our transducer and the vessels. If the flow is towards the transducer, the angle of incidence is good. We get this type of ideal waveform in which you can easily see the early systolic, peak systolic, end systolic, and diastolic, early diastolic, and end diastolic. If the angle is disturbed, if it is a little bit at the angulation, then this waveform will be disturbed. If it is more towards the 90 degrees, then this will be dampened waveform. And if it is away from the transducer, it will be below the baseline as it will be moving away. The basic settings for grayscale, good B mode image, sagittal section of cervix, Doppler, CFI spectral Doppler. For color Doppler imaging, we have settings, and for spectral Doppler, we have to adjust the gate size, adopt to vessel size. Gain, adjust to obtain good signals, noise ratio, PRF, pulse repetition frequency, or scale, adjust to flow velocity. In color Doppler settings, the wall filters and set too low, noise, set too high, you lose information or you create absent and diastolic flow. So if the wall filter is set very low, we will get noise.